Hi, thanks for watching. Today I'm going to be talking about coding. And coding is very important because you need to properly code what you do in order to get paid. Now, when working with supports and braces, what you want to do is use HCPCS codes. There is a CPT code for codes and braces, but it's 99070, and that covers everything. You want to code at the highest level of specificity, so you use the HCPCS codes because there are different codes for different types of devices. All right? Now, your main consideration here is to do what's medically necessary for the patient, and then you code what you did. It's that simple. But be aware that some devices require more of your time and talent than others and will bill at a higher level. Now, these codes and hence a reimbursement level includes your time in the fitting and adjustment of a device. In some cases, it may be appropriate to bill an E&M code if you do a special exam just to determine whether or not that device is necessary. And remember, some conditions are going to need imaging just for that purpose. A couple examples might be spondylolysis, spondylolisthesis, to determine the grade of severity of the spondylolisthesis. So that's an element too. And if you needed it, if it's medically necessary, it's billable. Now, these codes are based on the area covered by the brace or support and on the number of rigid panels and on the amount of time and talent of the doctor. Some devices are just simply dispensed. You just pick them off the wall, you hand them to the patient, you show them something, how to use them. Some are fitted, some are custom fitted. So you can see how that, at each level, that takes more of your time and talent. So, and some devices you want to keep in mind are step-down systems. They have removable rigid panels. So they start out at a high level when they have the anterior, posterior, and lateral panels in place. And then you start removing panels as it is appropriate for the patient's progress. So you build these devices at the highest level appropriate. And then you remove the panels as necessary. But if there's any doubt as to what should be done, you want to be sure that you have met the needs of the patient. And if there's any doubt, go to the higher level, because you can't go back and rebuild. And the patient needs that covered. And, you know, that's the way it works. So do what's necessary for the patient. That is the one message I want to repeat over and over. It's based on the needs of the patient. Let me give you an example here. An L0637, that is a device that has rigid anterior, posterior, and lateral panels and covers the area posteriorly from the sacrococcygeal joint to T9. So that's covering a large area. So you would start with all the panels in place, even if some of them are just in place for a couple days. And you would bill it at that level. Then you would remove the lateral panels as the patient was ready for that. You would remove the anterior panel when the patient was ready for that. You'd remove the posterior panel when the patient was ready. You've still got this belt that will help the patient remember they can't do everything they want to do. So you code this at the highest level, but you only code the device once. I know some people are under the mistaken impression that, you know, if you've got all panels in place, you code at that level. When you remove the lateral panels, you bill it at the level that includes the anterior and posterior panel. Nope, you only bill one. The other thing you want to consider is that some devices just plain old don't have codes associated with it. Now, if you cannot code it, you can't bill it to the insurance. So you need to consider these to be a cash item. So in summary, you should do what is medically necessary for the patient. You should code and bill what you did. Thanks for watching. Have a nice day.